Previously, no person realized what diabetes was. No person when questioned that somebody with typical signs and an extremely elevated blood glucose owned the situation, but a line ought to be drawn amidst those who own diabetes, and as well those who performed not, and no person could concur where to sketch it. The magnificent epidemiologist Kelly West recalled to his partners to request what they were performing, and it protruded that they just sketched their own lines wherever they desired. Globally, the spread of non-communicable chronic ailments is elevating at a horrible rate. Diabetes is recognized as one of the maximum 10 leading reasons of death in middle-revenue countries. It has arrived to 7th site in the high-revenue countries. There are 3 factors that relate to one another in social cognitive theory. Anyway, those factors can cause teaching to occur and contain the individual's personal practices, environmental agents, and behavior determinants. Positive teaching can become the effect beside changed negative manners, and a modern way of reasoning and behaving can improve. The balance of proof proposes that alterations in the quality and quantity of dietary fat influence diabetes risk. Self-efficacy affected not only the decision-producing procedure, but as well the beginning and maintenance procedures. Self-efficacy is the capability and procedure of developing only newly learned data, practice behaviors, and awareness. Diagnosis of kind 1 and kind 2 diabetes in youths offer an essential general and clinical healthness burden owing to the barriers of ailment administration and the risks of chronic and acute difficulties. Biologists dedicate a lot of energy and time to classification and believe this an essential introduction to more detailed realization. The expression type 1.5 diabetes connecting to the development in some from kind 2 to kind 1 diabetes was actually coined years in the past and stays an area of alive diabetes. Insulin impedance upregulates the beta cells metabolically, as well speeds their loss during glucotoxicity. Insulin treatment persists the standard of patronage for uncontrolled gestational diabetes mellitus, kind 1 diabetes, and kind 2 diabetes through pregnancy. Individuals have improved and advanced capability for observational education and authorized them to extend their skills and awareness quickly through data transferred by the rich set of models. Actually, virtually whole cognitive, behavior, and influential learning from immediate expertise can be accomplished vigorously by watching commune's actions and its effects for them.